Good evening, everyone, and thank you for joining us tonight for this COVID-19 telephone town hall. If you'd like to ask a question tonight, simply hit *3 on your phone and an operator will come and take your question. If you're listening online, it's pretty straightforward. You can type your question into the question box on the website. My name is Steve Patterson, and I'll be your host tonight. Tonight, we're bringing together Arapahoe and Douglas counties and the Tri-County Health Department together to talk about mental and public health during the COVID-19 crisis. We have clinical staff from AllHealth Network and the Aurora Mental Health Center here to answer your questions about how our current situation is affecting the mental health of you and your family. We know from talking with many of our citizens and from watching the news how stressful this is for all of us. Our experts tonight will help answer questions and provide tools and resources to help keep you emotionally healthy during this ongoing crisis. We would like everyone to know that we are practicing what we preach, and that means all of us are scattered in locations across town. It's important that you know we're practicing social distancing as we instruct others to do so. And I'm actually talking to you right now with a microphone on underneath my mask. We all have masks on too. We'll try to make this as seamless as possible, but with everyone in a different location, you may hear a little bit of silence on occasion. Just bear with us. But joining us tonight are members of the AllHealth Network, a nonprofit mental health organization that provides mental health services, behavior health, and substance use treatment in the Denver metro area. And Aurora Mental Health Center, a full-service community mental health organization that provides counseling educational services that focus on prevention and wellness, are joining us this evening too. Now again, if you have questions, in fact, we already have many lined up, but we're going to get to as many as we can tonight. But if you have questions tonight during this call, a simple reminder that if you're joining us and you want to ask that question, just simply press *3 on your phone or send your questions through the website. To kick things off tonight, we're going to go to Dr. John Douglas. Dr. John Douglas is with the Tri-County Health Organization. Dr. Douglas, if you could give us a situational update, that would be wonderful. Dr. Douglas?
Yeah, fine. Can you hear me okay?
I hear you great.
Okay, terrific. Okay, great to be with everybody this evening. Thanks for that kickoff, Steve. Tri-County Health Department, again, is the health department serving Arapahoe and Douglas counties as well as Adams County. We have been focused laser-like, not exactly 24/7, but just about for the last 2.5 months as the epidemic has progressed. The numbers go up every day, as I'm sure everybody's aware. Current tally is that there's just under 1.5 million cases worldwide, with about just over 80,000 deaths. That means about 5.5% of the people who were detected with infection worldwide have died. Those parallel numbers for the U.S. are 398,000. We've got about just over a quarter of the world's cases at this point. We've had over 12,000 deaths, and our case fatality rate nationally is around 3%. Colorado is growing as well. We've got around 5,500 cases. We've had almost 180 deaths. And in our own Tri-County area, which is about a quarter of the state's population, not surprisingly, we have about a quarter of the state's cases, 1,347, and about a quarter of the state's deaths. So this is a burgeoning problem. In my public health career, which spans about 40 years, this is by far the most serious public health problem I've ever seen. Historically, it's probably the biggest deal we faced since the great pandemic of influenza in 1918. We are currently working without a vaccine, without an antiviral treatment, so our major tool is being careful and trying to prevent spreading it to each other. The main way we've been doing that in Colorado, as those of you who are sitting at home know, is staying at home. We've had stay-at-home orders from the governor since March 26th. That followed several other social distancing measures that took place, closing schools, closing bars and restaurants, asking us not to gather first more than 500, then more than 50, now more than 10 in public places. And then finally, having us stay in our houses unless we have essential work or we have essential business to conduct in the community. We think we are beginning to see some potential light at the end of the tunnel. The reason we are doing all this social distancing business is because the fear is if we hadn't gotten ahead of the curve, our hospital system where folks with serious COVID need to be hospitalized, sometimes in the ICU and sometimes on a ventilator, that our hospital system could be overwhelmed. We would not have enough hospital beds, enough ICU beds, or enough ventilators to take care of people. I'm happy to report that while we are still very much in the thick of things, we've seen a little bit of glimmer of hope over the last couple of days, where we've seen fewer cases diagnosed than we had previously been seeing 2 days in a row. You can't take that to the bank, but it's cautious optimism that the social distancing, everybody staying at home with as much personal, economic, and frankly, mental pain and distress is beginning to pay off. Various measures of social distancing suggest that we're about 65 to 80% successful. We don't all stay at home as much as we could and should, but we're not doing bad as a society. I want to point out one new twist that's come along. Last Friday, the governor, and later that evening, the Centers for Disease Control advised all of us to wear non-medical grade masks when we go out to public places. If you go to the grocery store, wear a mask. If you're an essential worker and you're going to work, wear a mask. Why do we do this? The major rationale is that we've realized that a larger chunk of COVID infections are asymptomatic, meaning I don't know that I have it. I feel fine, and yet I'm potentially contagious to somebody else. And so my wearing a cloth, washable, reusable mask reduces my opportunity of transmitting infection to other people. We'd really love to see all of us adopt that. CDC actually today came out and said, we're serious. We actually even mean it would be good for kids. Having tried to get my granddaughter, who's 2, to wear a mask the other day, I'm a little concerned about how successful we can be with young children, but I think it's really good advice. I want to close my remarks by noting that not all of us are equally susceptible to the impacts of COVID. We are particularly concerned about our older folks, those over the age of 60, those with underlying diseases, and those living in circumstances that there may be high degrees of transmission, potentially persons experiencing homelessness or persons who are incarcerated. One thing that is common, however, is that all of us, whether we're susceptible to the severe pulmonary complications, are susceptible to the mental health issues, whether it's loneliness and sadness and feeling disconnected, or whether it's worse. And so that's an important reason I'm so glad to be part of this dialogue this evening with our partners who are dealing with mental health. Thank you very much.
Thank you, Dr. Douglas. That is Dr. John Douglas from Tri-County Health, and we appreciate that start. For everybody who's just joining, we want to get to as many questions as possible. There's a lot of folks that I know are going to have questions. We have an incredible panel to go as a resource for the questions that you might have tonight. To get in line for that question and to submit it to an operator, press *3 on your phone, and we will get it to as many questions as we can tonight. And also, if you're watching on the web, there's a dialog box where you can type in your question, and feel free to use that as well. And so again, if you have a question, please press *3 on your phone. We're going to start. There's an online question that we have coming up often, which is that there's so much uncertainty about this situation and what is the impact of prolonged stress on the body and mind. And if we could, I would like to move this over to Dr. Mara Kalin at Aurora Mental Health. Dr. Kalin, can you give us some feedback on the uncertainty of what's going on and what this means on our bodies and on our mind as we deal with this stress?
Sure, absolutely. I think the key word there is the uncertainty, right? I think one of the most difficult and stressful pieces of this, on top of the economic hardship and the potential of physical illness, is just the unpredictability about how long this will last, how bad it will be, how much it will change life for everybody. And I think that's a really hard thing to deal with. When we want to feel less stress, one of the best things that we can do is to make sure that we stick to a routine, that we do the things that we're used to doing every day, and that, sometimes with this new virus, there are things that we have to change in our routine. A lot of us are working from home. We have children that aren't in school. And I think it's really important to establish a new normal, that means that you have rituals that you do every day. You talk with your kids about the positive things that you're grateful for. You remind your kids about the ways that you are protecting them and taking care of them so that the family doesn't get sick. And, things like if you're working from home, making sure that you establish that routine so that your work and your home life don't completely blend together when you're in the same space. I think that's really important. And also talking with others and staying connected. We are all in this remote world with social distancing and many of us working remotely. And that doesn't mean that we don't need human connection. We absolutely need to stay connected to other people through the phone, through various electronic ways that we can, and make sure that we're talking about our worries and our concerns. That's really the best way to keep them manageable and under control.
Thank you, Dr. Kalin. That's Dr. Kalin Mara Kalin from the Aurora Mental Health facility. So, folks, again, if you have a question tonight, press *3. We really do want to give everybody a chance to talk about what's going on in our own mental health. These are unique circumstances with all of us being home and having to exist in this new environment that we didn't contemplate 6 weeks ago. So, again, feel free to ask your questions tonight. Press *3 on the phone. We've got a great panel lined up. One more question online really quickly. I would like to push this over. We're joined tonight by Daniel McKelkey, who's from the Douglas County Human Services. And, Daniel, we have a question online that says, I work in retail and lost my job recently. It's the first time I've been out of work, and I'm just scared. Where do I start to find help? Daniel, can you point this person in the right direction?
Thank you for the question. I'm sorry you lost your job. The first thing I would do is I would go to the state unemployment and apply for unemployment, and then I would go to whatever county you live in, whether that be Douglas or Arapahoe, go to their web pages and start applying for benefits. If you have a family, there will be a series of benefits that you can apply for. Even if you don't have a family, there will also be a series of benefits that you can apply for. Both counties have assistance that will help you pay your rent and utilities, as well as food, medical, and just life. That's where I would begin. Thank
you for that, Mr. McKelkey. So we want to listen to everybody. You got a chance to talk live too. So press *3 on your phone and we'll take your questions. Susan and Aurora. Susan, you are now live on the conference. Go ahead with your question.
Is there any way you can help supermarket workers?
Dr. Douglas, thoughts on helping out with supermarket workers? And obviously, they're on the front line of this as well, just like our healthcare folks. Dr. Douglas, comments on what we can do to help with people that are out there working in supermarkets.
So, yeah, thanks for the question. It's really an important one. Doctors, nurses, people in the ICUs, we clap for them every night. They're heroes. They really are heroes. They're doing fantastic work. But folks that are providing essential services to us, like grocery store workers, that is one of the places that remains open because we all need food. Those folks really deserve attention as well. A number of grocery stores have offered, I think, better accommodations, sick leave, hazardous duty pay, sneeze shields in front of where workers are standing. But that's far too non-systematic at this point. Our own department, literally just since Friday, has begun to think about what is it we can do to try to organize greater attention to me and you wearing masks when we go to the grocery store, since we're mostly helping them and not ourselves. But we're also interested in what departments like ours and others across the community can do to try to help provide masks to folks like our grocery store workers. This is not a theoretical concern. National media reported yesterday that although we're having thousands of deaths nationally, we had first reported cases of death among our grocery store workers. That's understandably created fear in them. And as we're thinking about our own mental health, I think, frankly, one of the other tools we have in this epidemic we haven't really referred to is kindness to others. And I think all of us being attentive to the sacrifices that the folks that are providing those services to us are making, and letting them know how much we appreciate it is really critical.
Thank you, Dr. Douglas. We've got a lot of doctors on. I want to bring Dr. Garrett Mills at the Aurora Mental Health into this conversation as well. We have a question online: can the stress of COVID-19 make someone who is already struggling with a mental health condition get worse? Dr. Garrett Mills, if somebody's already dealing with mental health issues, and then you add on this stress, what can they expect? Dr. Ann, are you there? Maybe I'm mute your phone. There we go. There you are.
Yes, thank you. I'm sorry, I was on mute. I think that's a really good question. One of the things that has happened in the media is that we have all been so focused on this new illness, this COVID-19, this frightening virus that is moving around the world, that we have not paid as much attention to good mental health or to the other health problems that have affected folks in the community before this pandemic started. And so what I would ask everyone to do is to take a pause and to think about how to maintain good mental health in general. One of the things that someone that is suffering from a mental illness can do is make sure that they stay in contact with care providers, to make sure that they stay in contact with those in the community that they trust and have good connections with. Unfortunately, during this time of social isolation and social distancing, wearing masks, etc., you also need to protect yourself physically. So I think using the telephone, I think reaching out by computer, as we are doing today, to reach other folks, I think anything that you can do to keep yourself connected with other people electronically from a distance is a really good thing. Staying on medications is another really important thing that people can do to keep their mental health intact. Contacting your provider, making sure that you have a good enough supply for the length of time that you're ill, understanding that mental health centers are still open, that maybe reaching out to a psychiatrist or to a therapist is still available to you, although probably in a different platform. And then knowing when to seek out crisis help and support. The Colorado Crisis Line is still up, still moving. There are still people on the other line waiting to give help and support. So I think people need to pay attention to the things that they know work for their mental health, even during these very scary times.
Thank you, Dr. Garrett Mills. Next, we're going to go to a question from Urson that we're going to direct towards Dr. Cynthia Grant, who's with the AllHealth Network. Urson, go ahead with your question for Dr. Cynthia Grant.
Hi, everyone. Thanks for taking the time to answer our questions. My question is, after the lockdown ends, are we going to transition? How are we going to transition back to normal life? Is it going to be in phases? And are you thinking about making wearing masks mandatory after the lockdown?
Hi, Urson. This is Cynthia Grant. I am going to answer your question with a little bit of a focus on the mental health aspects, and then I'll see if perhaps someone else on the call can address the mask issue. I think that part of what you're asking about is also starting to apply now as people start to come out of quarantine. And as we all have been separated from others, there has been a lot of different emotional reactions associated with that. Once we get over some of the fear and worry about our health and the health of our loved ones, I think that there are still going to be a lot of lingering effects. You've seen some things in the media that really question what is normal going to look like in terms of our lives. There is a lot of stress that people experience when they have to monitor themselves for different signs and symptoms of COVID-19. And that stress, although on the one hand we will be thrilled and excited to be able to be out in our community and to not have some of those fears, I think there's still going to be a fair amount of uncertainty that Dr. Kalin mentioned, as well as some guilt about not being able to get things accomplished or to do normal work, or even consistent parenting while we were during the quarantine. We're in such a historical time that the emotional and mental health changes that some of us are going through is just inevitable. When we transition and start to see the health of our community really stabilizing, I think that you're going to want to watch out for how children are responding, making sure that children who might be upset or still have some fears, especially as they're getting released back into the world, possibly not into schools, but certainly into the world, it's going to be really important to focus on reassuring children and really dealing with our own anxieties in that process. I do think that there's a lot of hope that'll be out there and a lot of connection that we're going to see between people once we get back into some of our regular day-to-day. You heard another caller that had asked about job loss, the financial insecurity that comes during a time like this might trigger some of the need for services that you heard Dr. Garrett Mills mention just a minute ago. So I think we're going to have to be really mindful of how we all are coping and to know that just like that everyone reacts differently when they are going into quarantine, that everyone is going to react differently as they come out of quarantine. So
Thank you,
with
Dr.
that, I'm going to turn over the mask question, which is not, that's a little more detailed.
Sure, and that's the thing is we're all getting used to this new culture where we find ourselves wearing masks. Before we get to that question, really quickly, folks, star 3 on your phone if you have a question so we can get to as many of you as possible. Dan also out in Centennial, he's got a question about masks. Dr. Douglas, if you can hold the line here and talk a little bit about masks. And Dan, go ahead. Dan, you got a question about masks as well.
Yes, thank you. I have been working from home since March 13th, mandatory work from home. And initially I was finding that I needed to walk my dogs more to get me out of the house and to do something. Since the mask issue has come up, I have stopped walking my dogs because I have no masks yet. I've ordered some masks. I don't know how long it'll take to get them. But in the short term, I'm wondering if I were to take my dogs out for a walk, could I supplement not having a mask by keeping a further distance from people, and what would you recommend in that type of walk? The nice thing about the Centennial area is that I have pretty open spaces to walk and to avoid people.
So, Dr. Douglas, maybe we could do those in that order. Dan's question about when we're walking around and what we should be thinking about with masks, and then as we start to come out of this, to the earlier caller's point about what we can expect for how long we'll be wearing masks. Dr. Douglas?
Okay, so these are both really good questions. Dan, first of all, let me say keep walking your dogs. Even though your mask hasn't arrived yet, you can do a couple things. One is you can do as you suggested, which is to take a bigger swerve around the people walking near you. Your exercise right now is, especially if you can socially distance, is more important than you're wearing the mask that's coming in the mail. Secondly, honestly, the governor said you can wrap a scarf around your face. You can take a ski mask. You could honestly take an old T-shirt and kind of cut it up and drape it, tie it around the back of your neck or a bandana. Those are probably not as good as cloth masks that have got little elastic things to go over your ears, but they are better than nothing. And as long as you are practicing that social distancing, they should suffice. So I'm so glad you asked that because your dogs need exercise. Please take them out. Regarding what I think was the other question about when we transition back to normal life, was the question about will mask wearing persist in that transition? Steve, I don't know if you caught that again.
Yeah, I did. What will that look like? And on the front side, is there going to be a period of time where we're wearing masks just to make sure that this virus is like? How do you think that's going to play into what our daily lives look like? You know, in a couple weeks and then in a couple months. And I think it's a question a lot of people are wondering.
Yeah, really, it's a great question. My own view is that, first of all, we just started this. It's going to evolve. It's very likely that we're going to refine recommendations about what this means and how often we should do it. By the way, as it gets hotter, masks are going to get stickier and less comfortable unless you're in sort of a cooled or ventilated place. So I think we have to be aware of that. I like the idea of us wearing masks. I've already sort of said why, but partly I think that the more of us that wear masks, the more we've got sort of an extra backup against transmission as we begin coming out of our stay-at-home lifestyle. So a lot of people have tried to put thought into which of the social distancing measures can we relax the first. Is it schools? Is it bars and restaurants? Is it going to worship services? Is it going out for things that are not quite so essential? My view is that masks, if enough of us will wear them enough of that time, have the capacity to help us get out more. And in that respect, this is just me talking. This is not a public health consensus. I think longer use of masks may get us more out of the house. And frankly, for me personally, if I could go to a clothing store, and which I can't do now, and get a new pair of pants, or a shoe store or whatnot, by wearing a mask, that would be a pretty good trade-off for me. So we don't know exactly. It's probably going to change. I think it might help us as we transition back to more, quote, normal life.
Thank you, Dr. Douglas. Dr. Kalin, we have a question from Stephanie that I think is going to resonate with a lot of folks. Stephanie, you're live with Dr. Kalin. Go ahead with your question.
Hello.
Hi, Stephanie.
Hi. So I'm wondering what you, as professionals, can do to help reframe the negative thoughts of doom and gloom. I'm finding that words like fear and panic and crisis and death, like that, they're causing people who wouldn't normally be hysterical or act afraid to now act that way. So what kind of words can you guys put out to the general public to help take some of those fears away?
Yeah, Dr. Kalin?
That is a great question, Stephanie. Thanks for that question. I think you're right. And I do think that we have to be really mindful of the language that we use. And, that those words and the panic, I think, is coming from a lot of different places. But, of course, one of the places that many of us are sort of glued to is the media and the sort of 24/7 news cycle that we live in. And certainly I know that when I turn on the TV these days, the news is always about COVID-19 and, death and the lack of PPE, personal protective gear, and all of these things. And I think that it's very easy to get oversaturated with news coming in from all of the many sources that we receive our news. So I think one thing to do is to really moderate the amount of time that you're spending on social media and watching the news, because it's very easy to get oversaturated, and then you do get drawn into this sort of feeling of panic, watching the numbers of cases go up and things like that. So I would limit exposure and choose your news sources based on where you're going to get information that's going to be useful to you, such as this panel today, that will really help you calm down and make good decisions for yourself and your family. I think the other thing to really be careful about is the language that we use when we talk to others, especially with kids, right? So making sure that when we're talking to kids, not that we're painting a rosy picture and sort of glossing over the severity, but that we're using developmentally appropriate language. We're focusing on the things that we're doing that are positive, and making sure that we answer kids' questions, but that we don't, invite scary information that they may not already know. So I think that the language that you choose when talking to others is really important. The media is also a piece that's really important. And the other thing I think is, really focusing on some of these other aspects of the situation that really are incredibly positive. The ways in which people have stepped up in their communities to help others, the ways in which our medical professionals have put their own health at risk to help save lives, and thinking about these individual stories and chipping in and helping your neighbor or connecting with somebody that might be more isolated, I think are ways to remind all of us that there's a lot of positive things going on in the world today as well.
Thank you, Doctor. So look, for everybody who's joining, there's thousands listening right now. We want to make sure that we can get to as many questions as possible. On the phone, if you're listening on the phone, you can ask a question. Simply press *3. We definitely want to spend our time tonight talking about what we're going through with our own stress and anxiety and the mental health that's associated with that. And also, just as a quick side note, too, also in your mailboxes, you're getting notes from the census that are asking you to complete and let you know, to let the census counters know where you're at. You can fill out your census questionnaire online or via the telephone, which means you don't have to leave your house. And if you'd rather complete the form by mail, watch for a paper copy of the questionnaire arriving soon. The census is very important. It funds so many different programs in so many parts of government. It's also important for us to count each and every member in our communities to help fund those projects like libraries and all the transportation projects we see around town, and of course health programs like we're talking about tonight. It's quick, it's easy, it takes about 10 minutes, and it's also safe. And so a lot to still talk about. We want to make sure we stay on point here. We're also joined this evening by Dr. Ryan Morose, who's at AllHealth Network. And Leanne and Centennial, you have, again, a question that I think the whole audience is going to appreciate hearing. Leanne and Centennial, go ahead for Dr. Morose.
Yes, thank you. We have a 14-year-old granddaughter. She'll be starting high school this coming year. She lives in two households. One, her dad, her father lives with myself, and then her mom lives in Centennial, and her mom lives up in Brighton. She's, of course, missing her mom right now because she's been staying with us. She wants to go back and forth. She's very torn and very depressed because she feels if she chooses one household to another, that somehow she's not being loyal to the other parent. And we just don't know what to do, how to help her, or what to say. And we've been trying, but it just seems to be a huge emotional thing, and I'm very worried about her.
Leanne, I can feel that. Dr. Ryan, some advice?
Hi, Leanne. Thanks for your question. I mean, I think COVID-19 is throwing a range of new challenges for parents, and especially those that are separated or divorced. And so, it's also really important that families, one, follow the court order if they can, but beyond that, the court order and agreements, that may have been signed previously might need to change in this time of uncertainty and requirements based on quarantine and isolation. What the guidance I would give is that it's really important that all of the adults or kind of guardians in this situation be on the same page first and foremost. I think, doing as much as you can to limit the pressure and the decision making that feels like it's on the shoulders of the child in this situation is really important. So first and foremost, I would have a discussion with the parents and the adults to make sure that all of the pros and cons of, either household are kind of established and discussed. And then I think I would have that conversation and in some ways make some decisions before bringing the child into the mix. I think the other piece to this is that there's not a lot of guidance out there in terms of, whether kids should be going between households. Certainly it should be limited, but there may be opportunities as well to make sure that, time is spent with each household, whether that means through, scheduled Zoom meetings or Skype calls or things like that. Those are details to also work out as a group of guardians or adults that are involved in this process. So that would be where I start. And I think that letting the child know that, again, emphasizing that this is not, a choice that's being made based on, whether she likes so-and-so better or more or is more loyal to so-and-so, but rather it's a group decision based on the risks, the pros and cons of residing at each household and whether folks need to be in isolation or quarantine at other households.
Thank you, Dr. Ryan Morose. Dr. Ryan is from, as many of our panel members are tonight, is from the AllHealth Network. It's a nonprofit community mental health center with 11 locations throughout Douglas and Arapahoe counties. They provide comprehensive mental health and substance use services. They also offer outpatient counseling and psychiatry for all ages and a 24/7 crisis mental health services for the community. You can learn more about these services that they offer at allhealthnetwork.org. Again, that's allhealthnetwork.org. That was Dr. Ryan Morose. We are next going to bear with me for a sec. We're next headed over to Ernesto. And Dr. Hendricks at AllHealth, this is, we're going to get you to comment on this. Ernesto and Aurora, go ahead.
My question for you guys is, what do we do when people over panic or have that instability during the financial hard times and during this virus, as we're not associating with other people and our doctors or therapists aren't able to provide the services sometimes under this quarantine?
Dr. Hendricks?
Ernesto, thank you so much for your call. It's a very stressful time for a lot of people, and the things that you are commenting on and identifying, I think, are just a mark of the times that we are experiencing right now. Frustration that our lives aren't the same, and trying to find a way to find a break from the distress during this anxiety and concern about our financial and health well-being. One of the things that I would say is it's important to take a break from social media and from the news. It can be a bit overwhelming, and maybe limit the amount of time that you're exposed to that. When you do have time alone, it's easy for the what ifs, what if this happens, what if that happens, to continue running through your mind. And when that happens, it's important to be able to kind of stop those and take a step back and identify what your current priorities are, some things that you can have control over, and try and focus and work on those. I would encourage people to start each day with a focus on gratitude, things that they do feel grateful for and that they can find happiness even during this difficult time. Sometimes taking a walk or exercise can help with that. I would say it's really important to find some kind of win in your life's new routine. Something that you can say, boy, I didn't have time to connect with this friend. I didn't have time to do this hobby or this thing that I used to like to do. I'm going to do that with some of the time that I have now. But if the distress and anxiety that you or a loved one is experiencing, it begins to lead to sleepless nights, or you wake up in the middle of the night, or if it's interfering with your quality of life or your ability to enjoy life, please reach out to AllHealth Network or the Aurora Mental Health Center for additional options. Both organizations are here to help, and we'd be happy to receive a call from you or anybody that you think we might be able to help.
Thank you, Dr. Hendricks. Again, folks, if you'd like to ask a question tonight, we certainly want you to. Press *3 on your phone. And listen, here's the thing. Arapahoe and Douglas County has partnered up to make sure that they can get the kind of experts and the doctors that we have available tonight to be able to answer your questions and be able to talk about the things that are impacting and affecting us all. If you want to get more information and continue to receive information for Arapahoe and Douglas County, you can do so really simply just by pressing 1 on your phone now. And while you're doing that, I would like to go to Jinx. Jinx, you have a question. Go ahead.
Hello?
Yep, I hear you.
Oh, okay. Yes, my question is actually for Tri-County Health. I am an RN. I also want to give kudos to actually AllHealth Network. I worked for that when they were Arapahoe Douglas. But my question is, and my background, I was in law enforcement in Colorado, and I did work on the Navajo Nation when we were having the hantavirus epidemic. So my question for Tri-County Health is, I didn't hear the doctor mention at all when he said that we don't have any treatments really for it. The fact is he not recommending hydroxychloroquine, which actually is used every day for lupus patients, but also has been used for malaria, and is shown to have quite a bit of effectiveness with this coronavirus. And we're even having politicians who were out there. And my second question is, first of all, I did have to laugh when I saw doctors and everything on TV saying, oh, don't wear masks, and all this, that could be harmful for you, because nothing could be further from the truth, and I knew the problem was we didn't have enough of them. But don't you think that the medical community could do more to put this in perspective, that every year we do have epidemics? We have the flu epidemics, we have the cold epidemics, and we certainly notice that when kids go back to school. All of a sudden everybody's got a cold and everything like that. And that, people, and that when in fact talking about the people that have said, well, should we wear masks at other times? Sure, if you're going out in public and you have a cold and you're coughing and sneezing all over the place, it would be good to wear a mask so you're not contaminating other people. But that's my question. Do you think the medical community could step up a little more to give these people that are getting really concerned about this and afraid a little more information and compare it to other things, other illnesses that we deal with all the time?
Thank you, Jinx. Dr. Douglas at Tri-County, a little to unpack there. First of all, some feedback on medications, and then how we're reacting to this socially.
Sure. Jinx, thanks for those really good questions. Thanks for your service, by the way, at Arapaho, Douglas, Navajo Nation, et cetera. Let me start with hydroxychloroquine. You're right. It's used for lupus. It's used for malaria. The laboratory data looked, I'd say, encouraging. Small clinical trials, and let me emphasize, really small clinical trials were promising. I think that using it in a setting where we can gather data about whether it's effective or not is a really good idea. It's being used in New York. I'm hoping they're collecting good data about it. I've got colleagues who are infectious disease inpatient doctors in Colorado. I used to be, I'm not anymore, that are involved with clinical trials testing it. I think that's really the way we're going to understand whether or not it's good enough and beneficial enough to be widely used. I can tell you from having been involved in investigational drug studies for many, many years, everything that looks good initially doesn't always pan out. So I like the fact that it's been around. It's not completely safe, but it's relatively safe. I took it myself when I went to Haiti 6 months ago. But I think that before we use it in outside of careful settings, we ought to get more data about it. I think this issue about the medical community putting this more in perspective is a really important question. Let me be blunt. This is far worse than seasonal influenza. When this initially came along, we thought, oh, this is just another form of the flu. It infects and harms the same people, the elderly, people with underlying heart and lung disease. What we've learned is that this is really more serious than the flu, and because virtually nobody has immunity against it, apart from those that have been recently affected, it has much more explosive potential. Now, having said that, I hear you loud and clear, and my behavioral health colleagues as well, is that this is all doom and gloom. It completely destroys sort of any kind of potential sense of well-being, and I think balance is the name of the game. Most people who have this do really fine. It's our friends, colleagues, grandparents, et cetera, who are older, who have underlying diseases that are going to get the worst outcomes from it. Those that are younger are not completely bulletproof. We just had a second death today in Colorado of somebody in their 30s. So we don't want to be blasé and say, let's go to the beach and go to spring break, no worries. But I hear you loud and clear. I think messaging balance is going to be critical as we move forward in the epidemic.
Thank you, Dr. Douglas. Dr. Douglas is from Tri-County Health. They have put out a website that's got a little bit more focused on local information to the Tri-County area. You can get some of that information with questions like some of the ones that we're hopefully getting to tonight and that we've been through at tchd-dot-org. Again, that's tchd-dot-org. There's a second site that you can go to from the state of Colorado, and you can access it at covid19.colorado.gov. Again, those are both kind of locally minded sites, covid19.colorado.gov. Dr. Douglas, I want to stay with you with an online question that we got from Grace this evening. She writes, her household has 3 adults who think we have already had the COVID-19 virus. We were not sick enough to involve a doctor. How do we know if we are not contagious? I think, Dr. Douglas, a lot of folks have had similar considerations. How do we know how can Grace know that she's not contagious anymore?
So, Grace, this is a really good, really good question. I haven't probably said enough that one of our impediments is not having good testing, and it sounds like your household has experienced that. We've had to triage testing for first responders, healthcare workers, and people really sick in the hospital. The current rule of thumb is if you have a COVID-like illness, and that is classically defined as fever with shortness of breath and cough. But we also know that lots of people don't get that full-blown illness and could just have a cold, and it's really, really hard to know. So the guidance is try to isolate yourself from other people for at least 3 days after your fever has gone away, and that means fever without taking anything like Tylenol that could suppress your fever. And when your symptoms, cough, shortness of breath, runny nose, etc., are improving, and it's been at least 7 days since you got sick. Now, that's pretty rough guidance, but it appears to be borne out by laboratory testing. And so that's the rough guideline that we're using. And I think in your circumstance, that would be a practical approach to take.
Thank you, Dr. Douglas. Dr. Kalin, I have a question online that I'd like you to weigh in on if you don't mind. William asks a very specific question. As this pandemic continues, more people are likely to get more and more frustrated and hopeless. In this mental state, a person is likely to end their balancing restraints and act in antisocial ways, violence, crime, burglary, the things that folks do that are antisocial. What's your outlook for this, and how can folks best cope? Dr. Kalin?
That's a really good question. I think one of the key things is that as the stress mounts, and certainly that is happening, there are so many different stressors that are playing into this situation. For somebody to not let it get to the point where they're hopeless and completely overwhelmed. I think it's really important once you recognize that the stress is getting to be overwhelming that you reach out and get some support or do some of the things that you already know work for you to manage your stress. Some of us use exercise. Many of us use talking with others to decrease their stress level. The other thing is that Aurora Mental Health Center and AllHealth Network are still open and are available to talk to people. The Aurora Mental Health Center has a chat line that we have set up that anybody can call into and talk to a professional right then and there. That person can help problem solve, can help come up with some coping strategies in the moment that should help with managing that stress while we're in this situation. So I think that as much as you can recognize in yourself and in your loved ones when the stress is becoming too much, and help get yourself some support or others support in the moment, I think that will really help things, prevent things from getting out of control and having really negative consequences.
Thank you, Doctor. Dr. Kalin joins us from the Aurora Mental Health Center, which is a private nonprofit community mental health organization that serves children, adults, and families with a wide range of mental health needs, and they've been doing this for a long time. They've been doing it since 1975. Their goal is to promote mental health, enable people to truly live their life to their fullest. folks, if you've got more questions, you can find them on their website at aumhc.org. Again, that's aumhc.org. I want to next jump over and Dr. Grant, Jeff doesn't say where Jeff's at, but Jeff's joining us, and he's got a question for you, Dr. Grant. Go ahead. Dr. Grant with the AllHealth Network. Jeff, you're live.
Hey guys, how's it going? Long-time listener, first-time caller. I own a small boutique gym that we all know how much a gym helps from a physical standpoint, but they're not as much as appreciated when it comes to mental health. Especially, I have some clients with severe mental issues, severe depression. Is there anything that I can do for these clients for them to still come in, use the equipment, wiping it down before and afterwards, wearing masks, staying 6 feet away? Or can I get like a doctor's note just saying how much, stressing the importance of what we're doing inside the gym actually is? Is there any kind of exempt thing for these patients?
That's a good question, Jeff. Dr. Grant, go ahead.
I totally hear you. Exercise is definitely one of the best treatments for depression. That's very well confirmed. However, I suspect that Dr. Douglas would tell you that it is not possible to bring people into the gym right now due to the risks of exposure, as much as I know you'd like to hear otherwise. But I know that there are many other ways that you can find time to work with your people who have members with your gym. They can connect with you on YouTube. We're seeing a lot of different gyms that are stepping up to the plate and offering tutorials and streaming. And I know that for my personal family, the part of the reason why I wanted to be able to answer your question is that I have a son who's a gym rat, had the exact same experience and built a makeshift gym in our garage because he couldn't get in to be able to lift. And I think that part of what you're really asking about is not possible because of COVID-19 risks, and yet is very possible in terms of how you can connect with your members. You can find something that they can control. Their workout, their exercise routine is absolutely one of them, and have them control the heck out of it with your support, just using an online venue.
Thank you, Dr. Grant. That's really helpful. We also tonight have Cheryl Turns, who's joining us from Arapahoe County Human Services. Cheryl, I have a question online that I think you might be able to help with. John asks, I have a neighbor who is a single parent and working a lot. I'm worried about her children being home alone more than they should. Is there anything I can do to help? Cheryl?
Yes, you could do two things. First, if you believe the children are being abused or neglected, then you should call and make a report. Call 303-636-1750. That's our child abuse and neglect hotline. And second, if you believe that the family needs help with child care assistance, please encourage your neighbor to apply for the Colorado Child Care Assistance Program by going online at colorado.gov/peak.
Thank you. John, we're going to go to you next, and I would like your question to be for Dr. Hendricks at the AllHealth Network. John, go ahead. Thank you for waiting.
Hi, Dr. Hendricks. I first want to say thank you to all you mental health workers. Gosh, to put it mildly, you mean the world to me. I am a bit older, Gen X, and so I have a bit of a dystopian view because I viewed, due to budget cuts in the 80s, the outflow of mental health patients and how much it impacted our society. And I worry now, with less money going into the coffers of our state government, whether you have any idea, will we have enough, and is there anything I can do? Because I worry about for myself and other people I know that get good care, and we're in for the long haul.
Dr. Hendricks, can you help comments on John?
Well, I just want to say, John, you know what? You mean the world to us, too. We're here to help, and we appreciate that these are very needed services and that they mean life or death to a lot of people in the state of Colorado. But you're right. Very often behavioral health services, mental health services, and SUD services are the last to be funded and the first to be cut. I do want to point out that at the federal level that dollars have been made available to help sustain behavioral health services, at least in the short run. But the state of Colorado is facing significant budget shortfalls, so the possibility of cuts to all areas in the state budget are very real. And I can almost guarantee you that there will be proposed cuts in behavioral health, as there will be on almost every area of the budget, as I mentioned. So the state is in the process of estimating future revenues and expenses and determining how severe those cuts will be. They're looking for low-hanging fruit and ways to making the cuts less severe. But as you can imagine, with the economy kind of tanking as it is in the current weeks, it's going to be difficult to come up with enough money to prevent significant cuts. And so what can you do? I think it's important that you reach out to your state legislators and let them know that behavioral health services are important to you and that they're important to your community, that having effective behavioral health services available to you are cost effective and that they can prevent more costly medical services, and early intervention on behavioral health can lead to reductions in substance use and reductions in inpatient hospitalization. And so it's important that to the extent that you're able, that you reach out to your state legislators and let them know that this is something that you value and that you hope that they will consider as they weigh the difficult choices that they're going to have to make in balancing the budget going forward.
Thank you, Dr. Hendricks. And to that point, folks, tonight, Douglas County and Arapahoe County, in partnership with also the Tri-County folks, are bringing this conversation to you. They definitely understand the importance of getting these experts on. I want to introduce a new one to our conversation tonight. It's Dr. Kelly Phillips-Henry. Dr. Phillips-Henry, we're going to go to Scott, who is in Arapahoe County. He's got a question. Scott, go ahead. You are live.
Hello. Good evening. I appreciate this call. We've given us some good information. We have a daughter that is a registered nurse, and she is in labor and delivery currently, but she has been an ER nurse. And in her nursing career, she picked up melioidosis was the disease she got from it, and it's damaged her lungs. And her hospital is trying to gear up for upcoming cases of coronavirus. And she's concerned that they may put her back in the ER. And she's had 2 bouts with that where she almost died both times. But both she and her husband is a paramedic firefighter. But the stress level in their house is quite high. They have children and child care. They're trying to, not have someone come in. But anyhow, I just wanted to see if maybe you can give some advice to our first responders that are out there that may be listening on the call, that, how to deal with the stress and just handle it better.
Dr. Kelly?
Absolutely. Scott, thank you for your question. And frankly, I understand that fear. It's real. And your daughter clearly is in a situation where she's contacted some things before, and so that would absolutely increase one's fear of potentially transitioning units. I will save that piece of the question for our Department of Health folks to address that part specifically. What I will address is that folks who are on the front line are experiencing a heightened level of stress than many of us that are doing our part by sheltering at home. And so when we have first responders, folks working on the front line, it is a very sustained stress that they're coming out of every single day or every other day, depending on shifts. And so what we know with our body physically is that if we go through a very short period of stress, most of us can typically get ourselves to a point where we can work down from it, we can get our heart rate down, we can begin to change the way we're thinking, and slowly come out of that. That's very different than someone who is working in an environment where they're going in and out of that every day and putting a lot of increased stress, one, on their body, two, mentally. And so, things that we would typically recommend to anyone who's living in that environment, back to some of the comments that have been made earlier, is to figure out what you can normalize in your day-to-day situation. And so some of those things may be very small in terms of how you start your day, whether it is some meditation or some exercise outside or a healthy, good breakfast. Having some predictability when you are going in and out of an environment that does not have that predictability can be very grounding for all of us. So routine, number one, is very important. I would say the second thing is that support system when you come home. I think that if you've got two folks that are working difficult shifts with children, my hunch is that there's probably some additional caretakers that are trying to help with folks who are having to actually leave their home right now. And so extending that support system, whether that be by phone, through technology, through neighbors, really giving that sense of normalness when they come home to their family. I think the other thing, as we work with folks who are front line responders, is that we need to be mindful that not all coping strategies are actually helpful, and that many folks during times of high stress turn to things that in the moment may feel that they help and in the long run don't necessarily help. And so any form of addiction is a heightened risk during this time. Not sleeping well is obviously going to cause a spiraling effect into other areas of our life, and or withdrawing from the ones who love and are asking questions about our day. And so these are times that while there may be some quick, easy ways to escape from reality, what we want to encourage for all of our family members is those healthier coping behaviors, because I think if they can employ them every day, it can help them build a new normal during a very stressful experience they're going through.
Dr. Callie, your tone of voice just makes me calm down. I feel better listening to you. She is with the Aurora Mental Health team, and if you like more resources on taking care of yourself during this crisis, they have an incredible resource. You can check this out. It's auroratv.org. Again, auroratv.org. They have a number of segments that include experts like Dr. Callie from Aurora Mental Health and other providers. There are many videos there that you can check out and peruse. They're all on demand. Listen, also for the last 53 minutes, Kay, you have patiently been waiting. Kay and Aurora, I have a question. I know you have a question. Go ahead live with your question.
Yeah,
okay?
I just wanted to say I'm over 80, and all this news about, if something happens, you're going to pretty much go first. If you get the virus, well, we're not going to take care of you. We're going to take care of people that are younger and more important to this society. It's pretty scary. I stay home. I'm very, very careful about what I do. But darn it, that's not a good thing. It's not a good feeling.
Dr. Douglas, I completely understand where Kay's coming from. Can you weigh in?
Sure. Let me be sure I'm unmuted. Yeah, thanks, Kay, for that comment. Let me say a couple of things. First of all, some of the earlier callers said let's not overblow what's happening with COVID, and I get that. But listen, if you're in your 80s, I really do understand your fear. Folks, the older we get, if we catch COVID, the more difficult time we have with it. One thing I do want to reassure you about is I sit on the governor's expert emergency epidemic response committee, and we just reviewed what we would consider to be crisis standards of care if we got into bad trouble and didn't have enough resources to take care of everyone. And we very specifically said there's not a particular group that gets on the blacklist or doesn't get taken care of. It's all based on assessments of the ability of somebody who's really sick to make it through the hospitalization, and their ability to have a meaningful life thereafter. Now, being older certainly plays into that somewhat, but it is absolutely not an absolute thing. So you're right to be concerned. I want you to take all the social distancing measures possible. I think masking, I'm wearing a mask, and I'm in my 60s. I think that's a great thing for all of us, really, no matter our age, to do. But I want you to rest assured that you're going to get as fair a shake in the hospitals as things evolve as anybody will.
Thank you, Dr. Douglas. Tonight we're also joined by Dr. Ann Garrett Mills. Dr. Garrett Mills, we have a question tonight online, and it goes like this. I see a lot of friends joking that they're drinking a lot more during the stay-at-home order. Does this situation put people at greater risk for drug and alcohol abuse, since that's what some folks are sitting home doing?
Yes, I think that's a really stupendous question. We don't talk enough about problems with substance abuse, substance dependence in our communities when we are under stress. I think the research from previous community stresses, from Katrina, the research from 9/11, and even the research here in Colorado after the theater shooting shows an uptick in the use of substances. I think it is safe to say that Americans and other human beings tend to reach for the familiar when they are not doing well, and sometimes the familiar is a substance of abuse or dependence. During this particular pandemic, many treatment facilities have shuttered their brick and mortar buildings and are only available online, but people don't know they're available. Harm reduction places that sort of provide needles and other kinds of resources for people who are abusing substances and are beginning to think about how to do that safely are also not as available. Let me tell you, SAMHSA has a great website that will direct you to substance use services online, per telephone, etc. At Aurora Mental Health Center, our detox facility is still open. The East Metro Detox Facility out on South Potomac Street for folks who need to get clean and sober. I would recommend to folks that they think about healthier coping mechanisms. Earlier, Dr. Phillips Henry talked about doing things like exercising and eating well, taking care of your body. I think focusing on wellness activities rather than substances that create a brief moment of feeling good but can create problems later is a great idea. The other thing is to think about this as a time to make changes in your life. This is a big transition in the community. So all of those teens that have been struggling with vaping and smoking, this is a time that they're now at home and they maybe need to think about how they might be able to spend their time differently. This is the time to reach out for help. So I think that was a really important question. We want to not have that uptick in substance use after this crisis abates.
Thank you, Dr. Mills. So, folks, let's make sure that we can continue to pay attention about how to do this well, and we could use your help. So we're going to ask a question. Just use your keypad to answer it if you don't mind. Do you feel that the information about the COVID crisis that you're receiving from Arapahoe and Douglas County is press 1 for adequate, reliable, and clear, press 2 for neutral, or press 3 for inadequate, unreliable, and or unclear? We're going to use this information to shape the information that we send to you during the crisis. So just one more time, do you feel the information that you've been receiving from Arapahoe and Douglas County about the COVID crisis is adequate, reliable, and clear? If so, press 1. If you're neutral about this, just press 2. And if you feel like this has been inadequate, unreliable, or unclear, simply press 3. All right. Al, you're in Aurora, and you've been patiently waiting for the better part of an hour. Al, go ahead.
Yes, I have a question, a general question. What criteria do you think the governor will use to lift the stay-at-home order? Will we reach certain benchmarks in deaths or new cases per day before they say not will the order be extended?
So, Dr. Douglas, I cut out a little bit at the end, but what Al said was, what are going to be the determinant factors for when folks can return to their a sense of what their normal lives were?
So that's really a fantastic question, Al, the one on everybody's minds right now. I think it's going to be looking at really two categories of inputs. One is how ready is the healthcare system to handle growing numbers of patients if that were to occur when we begin to have less social distancing. Right now, our estimates are that we're okay today. We're probably okay for the next week, but like every other state in the country, our hospitals are trying to get ventilators, personal protective equipment, and testing. And so we're expanding capacity, and I think when we get to a point where we think we could sustain a big hit on the healthcare system, that would be one component. The other component, as you've already suggested, is measures of reduced transmission. An early hint, again, it's not enough to rely on, is that we've had, for the past 2 days, fewer cases diagnosed than in previous days. And I think if we see that number continue to decline, if we see the number of people hospitalized continue to decline, and if we see some other areas such as positivity rates in people that are being tested pretty routinely, like healthcare workers with a cough, they get a test, some of us don't get a test. I think those are the kind of parameters we'll be looking at, or rather he'll be looking at, to make that decision.
Thank you, Dr. Douglas. And also everybody that let us know about how you feel about tonight's conversation and the information that Arapahoe and Douglas County. Thank you so much for overwhelmingly letting us know that this has been adequate and reliable and clear and concise. We do appreciate it. Before we say goodbye tonight, we want to say hello to a few commissioners that have joined us. From Douglas County first, let's go to Abe Layden. Abe, thanks for joining tonight. Any comments before we head off for the evening?
Absolutely, and thank you so much to everybody that called in. Tremendous thanks to my fellow elected officials, Dr. Douglas, our partners in public health, healthcare, and mental health. Look, I think the point is it's okay to not be okay, and for those that are calling in to perhaps get some questions answered about more urgent health needs, mental health needs, 844-493-TALK is a great crisis line, or you can text TALK to 38255. But what I would say is this, 4 points. Look, pace yourself, choose courage. This is temporary, and please look at the upside. Again, pace yourself. This is a marathon, not a sprint. I share that with my staff on a daily basis, and I think it's important to remember that. Choose courage. I love the Winston Churchill quote when he led Britain to victory in World War II, which is, fear is a reaction, courage is a decision. This is temporary. Things will go back to normal, and good news, as was shared tonight, we are seeing data that shows that staying home and social distancing is flattening the curve. And then finally, look at the upside. You know, in my lifetime, I have never seen so many people come together for the benefit of others and their families like we have now during this pandemic. And seeing the hearts to serve and make an impact is nothing short of inspiring. So pace yourself, choose courage, remember this is temporary, and please look at the upside.
Thank you for those words, Commissioner Layden. You're also tonight joined by your colleague, Laura Thomas. Laura, some closing comments.
Yes, thank you. I'd like to thank everyone who took the time to call in tonight. It's important to know that Douglas County for over 2 years has put a real importance on mental health. We fund a community response team, actually 4 different community response teams. That's a law enforcement officer paired with a mental health expert. So if you live in Douglas County and you feel that you need help, you can always call the Sheriff's Department and ask for the community response team. And you will have a clinician at your door who can help you work through your issues and get you follow-up care. So please take care of yourselves. And if you find yourself at a breaking point, call our Sheriff's Department and we can get help to your door very quickly. Thank you and God bless.
Thank you, Commissioner Thomas. In Arapahoe County, we're also fortunate to be joined by Commissioner Kathleen Conti. Commissioner Conti, some remarks?
I just want to thank everyone for taking the time to call in and get accurate information from our mental health experts and our good doctors that are out there serving us on a daily basis. Obviously, it is very important to keep up your activity level. Enjoy the outdoors, do so responsibly, walk your dogs, enjoy the wonderful trail system that we have in Arapahoe County that you can take advantage of, and do everything and recognize that we are all in this together, and together we will get through this crisis. And now a few words from my fellow commissioner, Miss Nancy Jackson.
Thank you.
Commissioner Jackson, there you are. Yep.
Yeah, I'm here. Thank you. And thank you to everybody who participated tonight, both on the panel, our moderators, and the folks that called in. I want to remind you that it's spring, and with spring, hope springs eternal. And I went out in my yard and picked a couple of flowers and put it on my table, so when I'm in meetings all day, I can look at the flowers and remember about spring. But we know that everybody is concerned about meeting your basic needs during and after the health crisis. And we know that paying close attention to your mental health is just as important as monitoring your physical health. So if you have any questions or concerns about ways that the county can help you get whatever assistance you need, reach out to us on our website, arapahogov.com. You can call the Aurora Mental Health Chat Line at 303-617-2300, or Rocky Mountain Crisis Partners Crisis Line, 844-493-8255. And we want to thank you again. We want to wish you good health, and we hope to see you all in person very soon. Thank you.
Thank you, everyone. Tonight we have put out a lot of web addresses, a lot of information, and we want you to not only be able to reference it, but also to tell your family and your friends and your neighbors about how to find this information. So thank you for joining us. Be well. And as a reminder, we will repost a copy of this recording to our websites in the next 24 hours so that you can play them back and also share some of those resources. Everybody have a good evening, and thank you for joining the conversation tonight. Bye-bye.